Hi, everyone, and welcome back to hashtag See Arthritis. As you know, if you've been watching some of the earlier broadcast videos, this is the hashtag See Arthritis event broadcast on Arthritis Broadcast Network by arthritis consumer experts. That's a lot of arthritis, isn't it, Dr. Twilt?
It is.
And we're so happy to be in studio again this year, our 12th year of broadcasting with Dr. Marinka Twilt. Welcome to the studio.
Thank you for having me.
Yeah, it's always a pleasure. Let me introduce you to the audience before we dive into our conversation. So, Dr. Marinka Twilt is a professor in the Cumming School of Medicine in the Department of Pediatrics at the University of Calgary, and a pediatric rheumatologist, meaning kids. Yes, kids get arthritis. At the Alberta Children's Hospital. She is a member of the, I think, highly esteemed McCaig Institute for Bone and Joint Health and a child health and wellness researcher at our Alberta Children's Hospital Research Institute. Her areas of research interest are JIA, so juvenile idiopathic arthritis associated, TMJ. I'm going to let you define all of these wonderful acronyms beyond here. Inflammation, vasculitis, autoinflammation, and precision medicine. So thank you so much again, Dr. Twilt, for joining us. We're going to talk to you today about your workshop that was held at the meeting. And the workshop title I love, by the way, Demystifying That Mysterious Joint, or TMJ, a succinct hands-on approach to TMJ assessment. And I'm not going to give the mystery away. I'm going to let you give the mystery away. But before we talk about TMJ assessment, tell our audience just a little bit about yourself and kind of contextualize your work, if you will.
Yeah. I'm Marinka Twilt. I'm a pediatric rheumatologist. I'm originally from the Netherlands, and I actually got interested in rheumatology in my fourth year of medical school when I had to do a research study, and I did it in pediatric rheumatology, and it actually turned out to be a PhD. And then I was so hooked that I was like, I have to go into pediatric rheumatology. So I actually got into a fellowship in sick kids, and that's how I ended up in Canada. In the meanwhile, I did go back to Europe, and I actually worked in Denmark and England as well for a little while before I then went to Calgary. And my interest, like my project was in TMJ arthritis, so temporomandibular or jaw arthritis. And that really has been sort of like my main focus of research, but I do a lot of other things as well. But that really has been the jaw joint that is sort of like my headache, but also my fun during my rheumatology journey. So that's sort of like how I got hooked into rheumatology and where I am now.
I love it. Well, once we get our hooks into the young up and coming docs, we don't never let them go. And I'm so glad that you're here and practicing in Canada. Tell us, so you had this workshop, and not everyone is like you. Not everyone is interested in that specific joint. In fact, probably very few in the world, I'm guessing. So
Yes.
tell us what the key takeaway messages were from your workshop. So I'm going to ask you to pronounce it very slowly. What is a TMJ? And how can a TMJ assessment help people living with arthritis, whether they're young, prime of life, or as older people?
Yeah. So the TMJ is the temporomandibular joint. So it is the joint that is just here before your ear. I mean, it's a very complicated joint because, as you can imagine, it can only move both at the same time. You're not able to move just the left side or just the right side. They have to both move to open your mouth. And there's a disc in there as well, which can also cause issues, specifically if you would have some bony issues there through to arthritis. It is specifically a problem in children because your jaw still grows until 25, and that's why we're so worried if children get inflammation in that jaw joint, because the growth plate is very superficial, which means any arthritis could potentially really influence that growth, and then your jaw wouldn't grow nicely forward. In adults, it doesn't give the growth abnormalities, but it gives a lot of pain, discomfort, and can actually lead to really an element of quality of life that is affected by it. Unfortunately, a lot of physicians sort of like stop here. If it comes to joints, they think anything below the neck is part of rheumatology and above the neck doesn't really apply. So it is important that you actually know how to examine this joint. And it's not something we learn in medical school, because in medical school, they talk about, abdomen and lungs and heart. And then in rheumatology, rheumatology programs, they talk really a lot about all the other joints, but not pediatric programs are getting better and better in incorporating the TMJ, but especially adult programs, they don't always think about the TMJ as a joint. And then if you actually measure the mouth opening at every visit, you can actually see who is developing TMJ issues. So that's why it's so important that we actually do know how to look at this joint. And that's why we developed first an OSCE. So if you're a medical school, you do all these OSCEs, which just means that you're getting a test patient in front of you and you have to explain in detail what you're doing to show that you're knowing how to examine either a certain joint or a certain organ. And we developed one specifically for the TMJ, which is online. So people can actually get access to it, and we gave access to the people who were in our workshop, and then we practiced actually during the workshop, and we have both pediatric and adult providers that are interested in a workshop, which is great. So I think we're finally getting there, that we're getting more and more people aware of the TMJ, and that we really need to examine this TMJ because it does really affect the quality of life. You use it the whole time, right? It's not like, your ankle you can sometimes not use because you will sit, but I mean, not using your TMJ, if you yawn, if you eat, if you talk, right, you're using your TMJ. So I think it's a very important joint. So that's why it is fantastic that we were able to do this workshop and that the CRA was supporting us with that.
Yeah, that's fantastic. You're quite right. As you know, because we've known each other for quite a number of years, I live with rheumatoid arthritis, and one of the first joints my disease developed was in the TMJ. Um, and I've had flares in that joint periodically and just recently, and I can attest to the pain piece. It is exceedingly painful and it's almost difficult to eat. You sort of liquefy some of your food at times.
Yes, yes,
Yeah.
yeah.
So listen, so I know what your workshop has done for healthcare professionals that attend the meeting. What does it mean for people living with arthritis out there in the communities across Canada? How many people with arthritis, generally speaking, have TMJ involvement? And then if they do, Dr. Twilt, what do we do about it?
Yeah, so that's a very important question. I think we know in children how often it is, because we are more aware of it and we do
Right.
more examinations in it. So we know that probably 8 out of 10 kids at one point during the disease course will have some TMJ
Wow.
involvement. It doesn't always lead to very severe problems, but we do know that if you would MRI them, they probably would have abnormalities. And there is the importance. The only way to really know that there is inflammation at this moment is an MRI. And you can imagine it's really hard to do an MRI every 3 months or every 6 months. In kids, even worse, because sometimes they have to be sedated if they're too
Yeah.
young. And that is a little bit the limitation at this moment. If you really want to know if there's inflammation, you should do an MRI. There are, though, some physical exam findings, if you would do them every time in clinic, that could help. And that's where this workshop came in, that if people would implement it in their clinic and they actually would measure mouth opening every time a patient comes to clinic, they could see small changes and that would potentially warn and say, you know what, we should do an MRI, or we should think about the fact that your TMJ might be involved in your disease process at this
Yeah.
moment.
Yeah.
If you have lots of joint involvement, you would go on a different medication anyway, and that would be good for the TMJ as well.
So if
But
it's effective, if my medicine is effective for my shoulders and my knees and
yes,
other joints, it's likely to be effective
it's
up here.
likely to be
Okay.
affected there. The biggest problem is if it would only be a flare in your TMJ, if you would only have a flare in a knee, they sometimes inject it, right? It's not always easy to inject a TMJ, and in kids, we're really concerned because of that growth plate. In adults, that's not as much. But then sometimes you have to do other things than doing just the adjustments of medication. So you can lavage, so you don't want to put steroids in a joint, but you could lavage it, not me, the maxillofacials right now.
Lavage meaning wash it.
Yeah, to wash it. You wash it
Okay.
out. Yeah, yeah.
Okay.
So that would be possible. And then physiotherapy can actually help, but you have to have somebody who knows how to do the physiotherapy, of course, because it's not as like every physiotherapist knows how to do TMJ physiotherapy. And then, as you said, sometimes it's also just easy things as adjust your diet a little bit, take the hard things out of it, right? I always no chewing gum. That's like my rule in clinic.
Yeah.
Gum. And then secondly, everything with a bar in it, like protein bar, chocolate bar, they're usually too chewy. So get those out. And then if you think about normal food, this is a time when you want to avoid your steak and you want to eat probably more mashed potatoes and
Pasta
chicken
and
and stuff
yeah,
like that, right? So those are things that you can do yourself as a patient as well. And even like sometimes it's like like if you do very extreme motion. So if you would yawn, that causes a lot of pain in some people. So even putting just your fist underneath your chin, and these are things that we're hoping with this workshop, people are more aware of, and they can coach their patients in clinic, and helping them, like, with some of these more conservative measures as a diet, physiotherapist, or like knowing what to do if there is inflammation.
yeah. What about night guards? Every dentist on the planet wants a patient to have a night guard.
Yeah.
Does that work in TMJ issues?
So it depends what kind of night guard it is. So the
Okay.
normal night guards, if they're soft, it actually aggravates because you're going to chew on it. So that actually would aggravate it. So if we talk about night guards, we actually talk about bite splints in TMJ disease. And those are hard acrylic splints. We usually want them to be on the upper teeth because then you sort of like can't find any friction when you're like closing your mouth, so it's like an ice rink almost, so you can't really
Yeah.
like bite on it. But these are a little more costly. The person needs to know what they're doing, because if you get one and they never ask you to come back to adjust it, it means that they're not doing a good job, because this
Ah,
needs a little bit of adjustments. So not every dentist knows how to do it, but there should be some dentist in the neighborhood in your area that could do it. But again, that is knowing what to ask for. Not a normal night guard, needs to be a hard acrylic splint, and but that does help because it sort of like take that tension off. Because a lot of time, people clench as well, and that actually like aggravates
exacerbates it. Yeah.
it.
Last sort of therapy question. I've done some reading myself because, as I've said, I have TMJ issues. I've read about laser therapy. Any merit to that?
No, I think the only other thing that really helps actually is Botox. So if you are a clencher, so if you would have a lot of muscle tension, and sometimes Botox actually, like both in a masseter, but also in these muscles and here, that actually helps with like taking that pressure off, and then like having relaxation of the jaw, and then opening that joint space a little bit.
Okay.
So that would be an option. Botox is also, especially if you're a clencher, is an option as well in TMJ.
Interesting. Okay, well, that's really helpful. Thank you so much. We're going to kind of close off our conversation a little bit, Dr. Twilt, with just getting your thoughts about your area of research. As you know, the theme of this year's meeting is shifting tides, embracing change in rheumatology, and celebrating the evolving landscape of it. What do you see as the evolving landscape over the next sort of 5 to 10 years, specific to your area of expertise?
Yeah, so I hope that we see like we're trying to find different ways of diagnosing so that we don't need that MRI, which is like long and costly, right? So that is one thing that I really hope that evolves, that we find other ways, such as like incorporating ultrasound or some other non-invasive treatments that we can help with, like, diagnosis, the diagnosing the TMJ arthritis. And then the second thing is still advocating. So to the adult population, especially my adult colleague providers, like, the TMJ is there. You need to examine it, and what
Yeah,
can you do for your patients, right? Because I think over the last 20 years, we've done a lot of like, we've gained a lot of like traction in the pediatric world, but I think we need to up it now and go to our adults colleagues and say we need to like make sure that we sort of like, embrace the change that we found in pediatrics and bring it to the adult world, that we can evolve the care there as well. That
yeah,
and it's a little bit
yeah.
more difficult for adults because, I mean, osteoarthritis can also happen in your jaw. So we need to make sure that we treat the patient correctly. But on the other hand, these non-conservative measures, doesn't matter if you have osteoarthritis or if you have like arthritis because you have RA, or if you have even disc problems, conservative physiotherapy, potentially Botox works for all of them, or at least can work for all of them, or splint, and it's not invasive, right? So in theory, that should be something that we should offer our patient population.
Yeah, I mean, anything that replaces an MRI, in my view, is a bonus. So get on it, would you? And
I am trying.
you're quite right that as an adult patient, I was diagnosed when I was 27, so just a few years ago. Um, I don't think I've ever had my TMJ examined. This is to our audience. Being a self-advocate, even when you're in clinic, is really important. And I don't know a rheumatologist in our Canadian community who would be upset by you raising an issue. That's
No.
why you're there, right?
Yeah.
You're there to deal with the either urgent or emerging issues that I'm having in my disease process.
And luckily, in the Canadian settings, most people know a pediatric rheumatologist in their area as well, so they can always reach out because we feel a little bit more comfortable with this joint because we
Yeah.
know it is such an issue because of the growth, right? You can always, like adult providers can always reach out to their pediatric partners for advice on like what to do, where to send. And if we, like, I got quite some text messages like, where do I send them for physiotherapy? Do you have somebody you would prefer, right? And I'm happy to answer those kind of questions in my area. I cannot know whole of
Yeah.
Canada, of course, but I mean, I think a lot of pediatric providers would be happy to help their adult. But yeah, if your rheumatologist doesn't ask actively, then mention it actively.
Yeah.
That's where you can
Yeah.
advocate yourself as a
Yeah.
patient to make sure that if you feel your TMJ is like different, causing you issues, and it doesn't mean it's arthritis because we go through phases where we can have other issues as well. That's what it's so complicated in the TMJ. But it's good to mention it so that your rheumatologist can decide: do I think this is to do with the underlying rheumatic disease, or should I send to a maxillofacial surgeon or to an orthodontist because there might be something else going on?
Yeah. Well, I'm just going to say Dr. Twilt said so. Is that okay?
Of course.
Thank you so much. I love that hit of spring that you're wearing. It's brightened up the studio considerably, as well as your incredible expertise and experience, Dr. Twilt. Thank you so much for joining us. Congratulations on your workshop at this year's meeting, and we look forward to having future conversations with you, either on this program or another one.
Thank you so much. It was my pleasure to be here.
All right, cheers.
Bye.
And thank you to our audience. Please come back. We'll be posting more episodes of #CArthritis.